During today's session, we will be discussing antipsychotic use in nursing homes. This topic is one of major concern in long-term care facilities. North Dakota has been above the national rate for the past 2 years for antipsychotic use in long-stay residents. North Dakota's antipsychotic rate for the year July 1st, 2023 through June 30th, 2024 was 22.09% compared to the national average of 14.67%. Today's session objectives are to 1. Identify the inherent risks for residents who are prescribed antipsychotic medications. 2. Describe prevention practices to reduce antipsychotic medication prescribing. 3. Discuss strategies to educate patients and family members about antipsychotic medications. In many nursing homes across our country, antipsychotic drugs are often prescribed for residents to treat or control behavioral and psychological symptoms of dementia. Some of these symptoms are aggression, agitation, irritability, and wandering. However, there are grave concerns about the inappropriate use of antipsychotics in this environment. These concerns include: antipsychotics are sometimes used off-label. Antipsychotics are sometimes prescribed without appropriate diagnosis or monitoring. Antipsychotics are sometimes prescribed solely for the convenience of staff. Antipsychotics can have increased risk of mortality when used with residents who have dementia. To reduce the inappropriate use of antipsychotics, nursing homes can develop processes for monitoring the use of psychotropic medications, promote gradual dose reductions when indicated, prevent the inappropriate prescribing of these drugs, monitor for targeted behaviors and potential adverse reactions. Residents who are prescribed antipsychotics face risks like movement disorders, metabolic syndrome, sedation, dizziness, dry mouth, sexual dysfunction, increased risk of falls, cognitive impairment, cardiovascular issues, and potential for worsening of dementia symptoms. Particularly in older adults, the severity of these risks can vary depending on the specific antipsychotic medication and individual factors. Key points about antipsychotic risks are: movement disorders. Some common movement disorders associated with antipsychotics include akathisia, restlessness, acute dystonia, muscle spasms, and tardive dyskinesia, involuntary movements, which can be particularly concerning in long-term use. Parkinson's-like symptoms. Elderly individuals might experience tremors, stiffness, and slow movements, again impacting their fall risk and self-care abilities. Metabolic effects. Antipsychotics can increase the risk of weight gain, high blood sugar, and high cholesterol, leading to metabolic syndrome. Sedation and cognitive impairment. Many antipsychotics can cause drowsiness and affect cognitive function, impacting daily activities and decision-making. Cardiovascular concerns. Certain antipsychotics may have potential cardiovascular side effects like arrhythmias and changes in blood pressure. Agranulocytosis, rare but serious. Some antipsychotics, like clozapine, can carry a very low risk of agranulocytosis, a condition where the body produces very low white blood cells. Dry mouth, difficulties chewing and swallowing food, decreased appetite, ability to taste. This can lead to tooth decay, problems with dentures, sores, and infection, also issues related to increased fluid intake. Urinary impact. Antipsychotics can cause urinary retention leading to UTIs and can increase urinary incontinence and/or nocturnal wetting, thus leading to the need for more cares or frequent needs for the restroom, increasing fall risk. Blurred vision can lead to trips and falls as well as affect balance and coordination. It can also reduce the ability to participate in enjoyable activities such as reading, writing, and needlework. Dizziness. Blood pressure may drop suddenly when standing up, leading to dizziness or fainting. Increased fall risk. Sedation, dizziness, and movement disorders associated with antipsychotics can increase the risk of falls, especially in older adults. It's crucial to conduct a thorough evaluation of the resident's medical history, including potential risks before prescribing antipsychotics. Monitoring the individual for changes in weight, blood sugar, and cholesterol is necessary. Also assess the resident regularly for avoidable infections like UTIs. Prescribing the lowest effective dose of medication is recommended to minimize side effects. In the past 20 years, there has been increasing evidence that the use of antipsychotics among older residents increases the risk of adverse events. Some residents may require these medications as a last resort. However, given what we know about the risks of using them to address behaviors associated with dementia, providers and nursing home staff should use alternative strategies first to support residents. Here are some practices to employ that can help reduce the use of antipsychotics. Non-pharmacological approaches. Try sensory practices like aromatherapy, massage, light therapy, and psychosocial practices like reminiscence therapy or pet therapy. Consider using a comfort menu to help relieve the resident's physical and emotional stress and discomfort. Example, ensure the lighting in the room isn't too bright. Structured care protocols. Use individualized care plans, communication strategies, and skills. Engage the resident and family with the plan. Psychosocial interventions. These may include behavioral therapy to help residents understand their disease and reduce emotional distress. Staff education. Raise awareness of risks with antipsychotic medication, prescribing, and educate staff on how to care for people with behavioral and psychological symptoms. Provider decision-making pathways. Use medication checklists, mood and behavioral charts, and other tools to help with decision-making. Regular medication reviews. Have pharmacists, general practitioners, or psychiatrists regularly review medications. Limit as needed orders. Limit as needed orders for psychotropic drugs to 14 days. Academic detailing. Use an evidence-based method to educate general practitioners on antipsychotic prescribing and deprescribing. It's important to have open discussion about behavior and non-pharmacological interventions that have been used. Clearly state the exact behaviors you're addressing, not just general terms like agitation. List the specific non-pharmacological interventions tried, explaining how they were implemented. Highlight any positive changes observed, such as lifestyle patterns and sleep schedules, even if not completely resolved. Mention that you're continuing to monitor the effectiveness of the interventions and will adjust them as needed. To effectively educate nursing home residents and their families about antipsychotics, providers should engage in open and clear communication, explain the risks and benefits of the medication thoroughly, discuss non-pharmacological alternatives, involve residents and family in decision-making, and provide ongoing monitoring and support while ensuring the residents' individual needs and concerns are addressed at every step. Key strategies include: explain the purpose of antipsychotics. Clearly state why the medication is being considered, including the specific behavioral symptoms it aims to manage. Discuss potential side effects. Be transparent about possible side effects like drowsiness, dry mouth, movement disorders, and metabolic changes, emphasizing the importance of reporting any concerns. Address concerns about dependence. Reassure families that antipsychotics are not meant to be used long-term unless necessary, and discuss potential strategies for tapering off the medication if appropriate. Highlight non-pharmacological options. Present alternative strategies to address behavioral issues, such as environmental modifications, activity programs, cognitive stimulation, and staff training on de-escalation techniques. If interventions have been tried and were unsuccessful, explain and discuss medications as an option. Personalized care plan. Develop a personalized care plan based on the resident's individual needs, including medication monitoring and regular reviews to assess effectiveness and potential side effects. Use plain language. Avoid medical jargon and explain concepts in a way that is easy for residents and family members to understand. Provide written information. Offer clear, concise written materials about antipsychotics, including potential risks and benefits for reference at home. There are a few other factors to understand when educating residents and families about antipsychotics. Be mindful of cultural factors that may influence understanding and acceptance of medication use. Adapt your communication style to each resident's cognitive abilities and level of understanding. Involve other healthcare team members like pharmacists, nurses, and social workers to provide comprehensive support. Given the current rate of antipsychotic prescribing in U.S. nursing homes, it's crucial to eliminate off-label use that is occurring for staff convenience. Providers, as well as nursing home staff and residents and families, will benefit greatly from ongoing education. Adoption of non-pharmacological interventions and personalized care plans will provide a safe, evidence-based avenue for reducing patient risks and improving care. Finally, collaboration among healthcare professionals within and outside the nursing home environment will help to ensure comprehensive support for residents. These are our references for this presentation. Thank you.